So now we have highly validated tools for measuring symptoms in MPN patients. Both the MPN symptom assessment form, which is the longest form, the MPN 10, which is kind of a 10 core item, or we have a smaller form for myelofibrosis. These forms are both overlappable, but they're publicly available. They can be used in paper. There are many electronic versions. And again, the key to remember with these forms is one, the patient is their own control. So the form is not to compare the absolute score between two patients, but to really see the relative change for that one individual. I also really look and I ask the patients, well, which of the symptoms are the most problematic? Both by score, but not the total score matters, but also really the granularity of the score. If you have a patient that has two items which are a 10 out of 10, that patient may be more impacted than an individual that has 10 items that each are a 2. So a lot of low-grade symptoms may not necessarily be as impactful as one or two that are highly symptomatic.